So you want to continue to compression for about 4 to 6 weeks. That'll just help your swelling. Your incisions only have about 85% of their strength and durability at 3 weeks, so you don't want to do anything to get your heart rate, your blood pressure up, and activity-wise right now, okay? Very nice. You doing okay? Okay. Now I'll be laid back for this, babe, okay? I'll pull this up for you.
Yeah, boy, here we go.
Doing okay? I mean, if you need a minute or if you feel like needing kind of pictures, because I know this tape is not super fun coming off.
No. I don't like her going to guy. You okay?
She's like, I'm not. You're sure gay film and you're just like,
Uh-huh. Oh, boy.
this is just an adhesive tape remover. It's sticking us off you. God, the incisions look great.
Great. Great.
You get lightheaded over there? You need to sit down.
I'm okay, I think.
Don't you go down on
I
me.
know. Boy, I can't.
Where'd you even be a nurse at one point?
That's why I'm not a nurse.
Oh,
I started off in nursing.
did you?
Yes, but I had to call my dad about 2 quarters into it. I'm like, Dad, I can't do it. I can't.
Oh, yeah.
Yeah. Well, actually, I wanted to be an anesthesiologist.
Oh, yeah. Uh-huh.
Just couldn't do it.
Yeah.
I went to the nursing home,
Oh, okay.
and they had us try to, take care of them, and I had to take this lady's teeth out, and I could not get them back in. And I was sweating, and I was shaking, and she was laying there. I felt like I was hurting her, and I finally got them in, and
Yeah.
I went back to my dorm, and I called my dad, and I said, Dad, I cannot do it. I changed my major. I think the most part I felt like I was hurting her.
Yeah.
And I was just, I can't do it.
Yeah. Doing okay? I know this is the least favorite part of the job is taking off tape.
Mm-hmm.
So they get to put it on while you're asleep. You have to take it off while you're awake.
Yeah.
You alright, babe?
Yeah.
Everything looks fantastic from a surgical standpoint. Very minimal swelling.
Good.
So your incisions will continue to go down and flatten. We'll go over some taping, okay?
Ooh, okay. Very good.
So you will have some sloughing on this area, so don't feel like your nipple completely falls off. It'll kind of slough like a sunburn and peel.
Oh,
So
okay.
you'll lose some of the pigment, and that's normal to where it'll turn kind of pink,
Uh-huh.
and that's normal.
Okay.
To get the pigment back, it just takes a while.
Okay.
Everything's great.
Okay. Good. Very good.
You're going to the shower, get everything nice and wet and soapy. Just let your back turn to the shower, so you don't have the shower be directly on the chest, okay? The water can run down and soap, and then you just gently pat them dry, and then we'll dress them back up.
You are listening to that, right?
Yeah.
Okay.
And you recording it, right?
Yeah?
We'll give you written instructions.
Good.
Okay. So there's 3 sheets to this over here.
Mhm.
So I'll give you this, and then when you run out of this, then you can just go to like Aquaphor or Vaseline and a Band-Aid, just
Okay.
to kind of help protect the
Okay.
nipple area, because you'll still wear compression for about 4 to 6 weeks. So some people feel like a barrier when that skin's pink and it's still healing, just so you don't have the ACE wrap or IE vest compression shirt rubbing against the nipple if it's still sensitive.
Okay.
Or altered sensation, because sometimes you might not feel because of the altered sensation, so you don't want
Mhm.
anything to rub and irritate it.
Okay.
So you can do this until you run out of this, and then just go to a little antibiotic ointment or Vaseline and a Band-Aid.
Okay.
So these are stuck together.
Uh-huh.
You see there's 3 different sheets. You only need 1 layer,
Okay.
1 little piece,
Okay.
because that way it'll last you for a while.
Okay.
And you're just cutting it just a square, just a size large enough to go over that nipple areola, okay?
Okay.
You don't have to do the small 2x2 if you don't want to, but just do the 4x4 if you still have that, okay?
Okay.
And you can either put the ointment directly on this
Mhm.
or directly on the nipple areola complex. You want to keep it nice and moist. That's the dressing you've had on all week,
Okay.
so it doesn't pull or anything when you come and take it off, okay? Because you want to still be very gentle when you do take it off, okay?
Okay.
I can grab some ointment real quick because I'm out.
Okay. Okay. Bleeding a little bit, yeah. I think that's probably normal.
This one looks better. This one
Mm-hmm.
feels so weird. When she was rubbing it, it was like numb, but like
You could feel it a little bit.
I could feel it definitely.
Mm-hmm. Oh, okay.
Weird.
Okay.
So just put a nice generous layer on there, okay?
Okay.
Have any questions so far?
Nope.
I'm also going to give you some self tape you can use
Okay.
for on the incision to help flatten it. You're going to change it out once a week if it'll last you for a week, okay? I don't want you changing it every day because it's going to
Okay.
irritate the skin. Be
Okay.
sure when you take it off, your skin's nice and moist in the shower, because you'll feel it's pretty sticky adhesive, okay?
Okay.
And he likes you to do this for several months, okay?
Okay. That one's bleeding a little bit. Is that okay?
Mm-hmm.
Okay. Okay.
That is normal. It has dissolvable stitches, and sometimes when you take the dressing off a
Oh.
little bit.
Uh-huh. I see. Okay.
I'll give you that roll.
Okay.
Okay.
Okay. Very good.
Okay.
Mm-hmm. Super.
So you want to continue your ACE wraps or some type of compression or
Okay.
vest or ACE,
Okay.
like it's an Under Armour type shirt or sleeveless vest, somewhere you have, as long as you have compression on, okay?
Okay.
For at least 4 to 6 weeks, because that's what's going to help your swelling
Okay.
and help you from preventing any fluid or anything behind this chest, okay?
Okay. Alright.
And we'll put your ACE wraps back on.
Okay. And still keep his arms down, right?
Yeah, this is kind of the happy
mean-
place. I
Yeah.
always say your incisions have about 85% of their strength and durability at 3 weeks. They're very fragile. So
Okay.
anything that increases your heart rate, your blood pressure is going to cause this area to swell. When you swell to a new operative site, it puts pressure on the area that's very weak, which is our incision line.
Yeah.
Run the risk of widening that incision and or opening it up.
Okay.
So for the first few weeks, I'll tell you not to lift anything over 5 pounds really.
Okay.
Not physical full activity till you're closer to 6 weeks till you're released from the office.
Okay. Okay.
Do you feel better with 2 ACEs or okay with 1?
Uh,
I'll just sit up on the bed. Don't you put 1 on and see how you do.
yeah.
You're never going to go wrong with extra compression, but
Yeah. Well, maybe we should
some
do
people
2.
when they're,
Yeah.
of this size and with
You know what? She put some lines on there so I could see about how tight to put it after she wrapped it.
Oh yeah.
Yeah. So I have a tendency. I think I would put it too tight.
Well, that's why I always ask the patient because they're the
Uh-huh.
only ones that ever going to feel it to know how snug it is.
Okay. Okay.
So I always let them know. I always ask usually as I'm doing it, does this feel okay?
Okay.
You doing all right?
Mhm.
Too tight? Or are you okay? That feel okay? Okay.
Let me stop now.